Welcome, everyone. Good morning or good afternoon, depending on where you're listening from. This is the WIC Works webinar on saving lives by reducing alcohol use in the WIC program. We have almost 100 people coming on, so that's really great. We're glad you're with us. This is Margaret Almond with the California WIC Association, and with me are Lori True, our Executive Director, and Karen Farley, our Program Manager, and they'll be introducing our panelists shortly. I will be going over a few introductory slides first, and you should see the first slide at this point. If you're not able to see it at any time, you may need to exit the webinar and re-enter. But we certainly apologize for any inconvenience and hope that you're able to successfully see and hear us. All right. Just to briefly go over the webinar objectives, you probably looked into these when you decided to join us, but we're going to look at and hear about a brief intervention that's been effective in limiting alcohol drinking during pregnancy and how it's worked in busy WIC settings and what some of the dramatic outcomes have been for positive birth outcomes. Just a few slides about using our program GoToWebinar. We have found a few glitches, but in general, it's working okay. You can listen using your computer speakers or telephone. If you do have any problems hearing over your computer speakers over the internet, please dial in on the landline. The number is there and at the base of each of these slides. If you are connected by phone, please don't put your line on hold because we can get interference for the entire attendees. And if you can't see the slides, as I mentioned before, try exiting and re-entering the webinar. You have a control panel on the side. If you've never used GoToWebinar before, this will just briefly take you through. There's a red button with an arrow that you can minimize it to see more of your own screen, or you can bring it back on. You can check how to use the telephone using the PIN number that's provided. And instead of this chat function, we'll ask you to use the question function to type any messages or questions to us, and we'll review those later. And there's some options for viewing your screen. So back to questions. We'll review those and prioritize them at the end and have our panelists answer as many as possible. But just remember that this webinar is being recorded, and that will be available on our website by tomorrow noon. We're not offering CEUs for this webinar, partly because it's short and sweet. And if you are tweeting, please use the Twitter hashtag to spread the word about these webinars. That's WICWorks. Just briefly about the California WIC Association. We're a nonprofit organization serving 84 local WIC agencies in California, but our reach is much broader to all parties interested in operating and supporting and advocating for the WIC program nationwide. We do training and staff development, we put on a conference, and advocate at the legislative and public education levels. I'm going to turn this over to Lori, who's going to introduce our panelists and turn our screen over to our panelists.
Good morning, afternoon, everyone, and welcome to our final webinar in this current series, where we have been sharing some very exciting and innovative practices that we've discovered and documented in the California WIC program that really document how WIC is working to improve the health, well-being of the families that we serve. And this final webinar is about essentially a fetal poison called alcohol. And if anyone ever questions you when you tell an advocate, a policymaker or a legislator that WIC isn't working or that WIC isn't saving lives, please tell them this story, because this is an example of how a very simple intervention during that magical few minutes that you have with WIC participants in your office, in a busy, crowded office, a very brief conversation about alcohol can actually save a life. and it's such a profound discovery that we want to really make sure you share it with people and consider implementing this brief intervention that's been tested, piloted here in California, and that is now being shared across the country. So with us we have two wonderful WIC masters from the Public Health Foundation Enterprises WIC program down in Los Angeles. First, we'll hear from Shannon Whaley, who is the research director down at PHFE. She's been presenting a few of these webinars already in our series. And then we'll hear from Samar McGregor, who is a senior nutritionist at PHFE, who has been helping Shannon and the community spread the word about this project in trainings, not only in California but across the country. So with that, welcome Shannon and Samar, and tell us what you found out. Thanks.
Thanks, Lori. Thanks, Margaret. I'm slowly getting my screen to come up. So are you seeing my screen yet?
We are here, and hopefully our other attendees are as well.
Great. And we're still waiting for it to get to slideshow view. There seems to be a little slowness in the go-to meetings today, but I think we're going to get there. So thanks for inviting us to participate. We're always delighted with everything that CWA does, and getting the word out in this quick format, I think, is just a great asset to the WIC community nationwide. So thanks for inviting us. I'm going to, I guess, start, even though I'm not seeing a full screen mode yet. We're going to trust that that's going to come any moment, but I, of course, would like to get to my next slide to start.
You should be able to click on, oh, there we go.
There we go.
Here we go.
Excellent.
All right, here we go. Ta-da, here we go. So I'm sure many of you are familiar with the impact of prenatal alcohol consumption on fetuses. Lori did a nice preview for you, and the focus of today's session is not to give you a tutorial on what happens to babies when their mothers drink. I'd be happy to get emails from you and send you information on that, but we know that alcohol use during pregnancy is the leading cause of known cause of mental retardation, and it comes at a very large price tag with costs, health costs, educational costs, and long-term reduced productivity costs to the society. So we know this is a big problem, and we know it's entirely preventable. What we need to do is help moms and assist moms to not drink any alcohol while they are pregnant. Nationwide, many of you know, WIC serves 50% of every baby born in this country, whereas Samar and I are sitting now in Los Angeles County, where we serve 69% of all the births in this county. So WIC has terrific potential to reduce prenatal alcohol exposure across the country by serving as many babies as we serve. The big question is always, how do we do this? Alcohol use is a sensitive topic. Lots of moms don't like to talk about it. They know that they're not supposed to do it, so social desirability is a concern. And the reason many moms know they're not supposed to is because of lots of success in the industry of putting things like labels on bottles and messaging out there that people know, and they should know if they read the label on the bottle, that it's risky for their baby if they drink during pregnancy. So while it's a good thing to have all those labels, what it also means is that moms are often more reticent to admit what they're doing. Many WIC staff, and really staff in multiple settings, healthcare settings all around across the board, report feeling uncomfortable talking to clients about alcohol use. And we also know that the approach matters. If you ask a woman, do you drink, the invariable answer will be, no, of course not. So we have to be very creative in our approaches to how we talk to moms about alcohol use prenatally. Way back when, now unbelievably 10 years ago, we did a study funded by the National Institute of Alcoholism and Alcohol Abuse. They funded our randomized controlled study of a prenatal alcohol prevention strategy in the WIC setting. We did this with a great partner with UCLA. Mary J. O'Connor was my co-PI in this work, and we embarked on what we called Project CARE. The name was actually selected by our frontline WIC nutritionists, and CARE stands for Cease Alcohol-Related Exposure. But I don't know, I might be the only person that still remembers that. We just know CARE as the Prevent Alcohol During Pregnancy project. But we had these cute little flyers with this cute little healthy baby, and the whole project was really, moms in general want to have a healthy baby. They want to have a healthy pregnancy and a healthy baby. So that's really what we're trying to dive into with our discussions with moms. The specific aims of our project then were to improve the detection of alcohol use during pregnancy, so improving our screening techniques in the WIC setting, not just saying, do you drink, but being a little bit more sophisticated. And then second, to evaluate the impact of what we call a brief intervention on the drinking behavior of pregnant WIC participants. And I will go in more detail about what a brief intervention means in just a moment. Down here at PHF, we have over 55 WIC sites now. We serve over 300,000 participants a month in our sites, so we're the biggest. What that enables us to do is lots of fun things with randomizing clinics to different conditions. So what we did, sorry, I need to close something. We randomly selected 12 of our WIC sites to be project care sites. And at all 12 of those sites, we improved the screening. Then we left our remaining 43 sites to just get the same WIC standard screening that we'd always been doing before 2002, which was 2 basic questions and move on. You know, ask about, do you drink, and is there a problem with alcohol or drugs in your family, and then continue to provide a standard message that the safest thing during pregnancy is not to drink anything. So at these 12 sites over on the left, we have these 12 project care sites. We randomized 6 of those to an assessment-only condition. So we only improved the screening there. So we improved how to ask about alcohol use during the pregnancy period. And then we taught those nutritionists to give the standard message that the safest thing for your baby during pregnancy is not to drink any alcohol. The other 6 sites did the same screening. So we have this improved screening that I'll talk about in a moment. And then they provided a brief intervention to the moms who reported alcohol use. So that's how we designed the study, so that we could determine whether screening helped, and in addition to screening, did a brief intervention help even more to help moms stop drinking during pregnancy. All right, slide, you can forward now. Well, isn't this unfortunate? Let's see. All right, here we are. So the first question, of course, is how do you improve screening when we don't want to just say, do you drink? What we have found to be very successful, and we base this, of course, on the research literature at the time, which is continuing to evolve in these last 10 years, is that using a self-report questionnaire is very helpful. So letting the mom fill something out on paper before she even talks to a person can be very helpful. Second, asking the alcohol questions after the nutrition questions works beautifully, because really alcohol and what she's drinking is really a part of her caloric intake. So WIC as a nutrition program can nicely integrate alcohol questions in as part of a woman's diet. And that, I think, is a real strength of the WIC program, and fitting protocols like this into WIC, that other programs like healthcare providers don't necessarily have that advantage. Also, it's very important to ask about the period of time before the mom knew she was pregnant. So lots of, if you're a woman who's of childbearing age and you drink a little bit every day and you're not pregnant, it's really not a problem. So people are definitely more willing to talk about the period of time before they knew they were pregnant. And if you start with that period, it definitely reduces the sort of social desirability factor that comes out, because then you can move into, well, since you found out you were pregnant, now what are you doing? And that dialogue takes on a much more meaningful approach. And finally, we do ask about binge episodes. Different cultural groups tend to have very different types of drinking patterns, and often binge episodes can be considered like, oh, well, I only drank once. Just so happened you had 8 drinks on that occasion, but people who binge often can minimize that behavior, and it's important then to look at binge episodes as well. So second then, before I go into results, I would like to share what is a brief intervention. Most of you in WIC are very familiar now with brief motivational interviewing. It's sort of something that we're all incorporating across the board, part of VINA, really thinking about client-centered approaches. So this is really just a piece of brief motivational interviewing, but providing a short manualized intervention targeted at a specific behavior. By manualized, I mean it's a 10-page workbook. We are showing a picture of it here on the right. This is available on our website, and we'll give you all the links to that at the end of this. But you can download this workbook in English, Spanish, Chinese, and Vietnamese from our website, and you can use it with your clients. It's very participant-centered. The hallmark of a brief intervention generally is that it's conducted by a health professional, but it doesn't have to necessarily be one that has extensive training in the topic or in substance abuse. So it's ideally suited to the WIC setting. You need it only once or a few times to be effective, and it's very easy to use. So that's sort of what the brief intervention, the hallmarks of brief intervention are. In the case of our brief intervention manual, it starts with educating the mom about the risks of drinking, then helps her identify what her specific risky situations are for drinking. Does she drink at parties? Does she drink when she's stressed, etc.? It helps her identify ways to cope or ways to cut down on her drinking. So when she's in those circumstances, she makes different choices. It provides a little more education for the mom if she would like it, and then works on contracting with her. What is she going to do for the next month or 2 months or 3 months till I see her again? Will she stop? And how sure is she that she can do that? So here's a busy slide, but what I want to do first is show you the impact of just improving screening. So the top line are all 12 of the project care sites and their screening rates. And the bottom line are those 43 remaining PHFE-WIC sites where we didn't change a thing. We just kept asking the same 2 questions in our, what we call out here in California, ISIS, our database that collects all this information. So the bottom line is the screening rate when you don't change anything, and you'll see that is hovering right around 5%, between 4 and 6% throughout the course of the study. We're using those other screening questions, which were the do you drink kinds of things, picked up about 4 to 5% of pregnant moms who were drinking alcohol. When we improved our protocols with an enhanced screener, and what we did is we incorporated questions right onto our prenatal nutrition questionnaire, just 5 questions, top questions about before you knew you were pregnant, questions about now, and a question about binge. We'd be happy to send that out to you as well. You see that screening rates go up dramatically. So really improving your screening techniques really helps you to identify pregnant women who are drinking during their pregnancy. Now, of course, when that happens, staff immediately want to know, oh my, what do I do with this woman? Now I see that there's a bigger problem here than I knew of before, so I need a tool that I can use to counsel this woman about her drinking. So that's where the brief intervention comes in. These bars, the blue bars, are the bars where the women got assessment only, or only the screening tool. So those 6 project care sites that were in the screening only condition. And the green bars are the bars where the women got the brief intervention. You see at intake, everyone's drinking, because to be drawn into the study sample, you needed to be drinking. But at first follow-up, which was anywhere from 1 to 3 months later, you see the women who got brief intervention, all but one had stopped drinking. The good news is about 70% of the moms who just got better screening also stopped drinking. So it does suggest that in general, moms do want to have healthy babies. And when you start to talk about this issue, they do stop drinking, and many will just stop drinking naturally. But that brief intervention really helps mothers to quit faster, and that by 3rd trimester, no mom in the brief intervention condition was drinking, and 10% of the moms in the screening only, assessment only condition were still drinking. So it gave us pretty clear evidence that if you can't do the brief intervention, at least do better screening, because that helps. But then if you can give your staff the tools, and again, it only takes, actually I haven't said this yet, it only takes about 8 minutes to provide the brief intervention. If you can provide those tools to staff, you see dramatic reductions in the amount of consumption of alcohol that goes on later in pregnancy. And so this showed that drinking behavior changes when you provide brief intervention. Our next question is, are the babies healthier? What this slide shows is the impact of brief intervention on birth lengths of the babies born to women in the screening only, which is the blue line, and in the brief intervention condition, which is the green line. It's a very complicated slide, so I'm going to walk you through it. The 2 points are on the left side are women who had less than 2 drinks per occasion, and on the right side are women who had more than 2 drinks per occasion. So the fact that the green line, or the brief intervention line, stays flat suggests that regardless of the level that moms had reported she was drinking at intake, the babies were equal length. So they were sort of equally healthy whether the moms had reported low levels or high levels of drinking early on, which suggests that those moms certainly did stop. The downward slope of the blue line shows that in the screening-only condition, the moms who drank less than 2 drinks, those babies are good birth lengths. They're about the same as the moms in the brief intervention condition. But for moms in the screening-only condition who reported initially drinking more than 2 drinks per occasion, those birth lengths are attenuated, really suggesting that while the screening seems to have worked in moms telling us they're not drinking, we're not convinced they actually stopped drinking, because their babies' birth lengths are shorter than we would expect them to be. The other piece of evidence is infant mortality rates we differed between the two groups. In the assessment only or screening only group, we had 17.7 out of 1,000 births that were infant mortalities versus only 1 in the brief intervention condition, which is 4.4 in 1,000. So we saw a pretty dramatic effect on infant mortality rates, suggesting that brief intervention, in addition to helping moms stop drinking, I think really is helping moms stop drinking, because the birth outcomes of those babies were significantly healthier. So we went through the process of publication, and the paper of all these details, for those of you who want it, is in the 2007 issue of American Journal of Public Health. That's listed here if you want all the gory details. And I'm delighted now to pass it over to Samar, who's going to talk about what we've done with these findings since we completed the research. So, Samar.
Thank you. So through the publication that Shannon just mentioned, Project CARE became part of the evidence base for reducing prenatal alcohol use, and it became the norm at PHFE WIC. So as a result of that as well, we were invited by SAMHSA, which is a Substance Abuse and Mental Health Services Administration, through Northrop FASD Center for Excellence, to provide training to WIC and Healthy Start programs in 6 states. We were also invited through funding by one-time special project funds to California WIC. We're invited by the state WIC to provide trainings at 33 local agencies. So we provided trainings throughout the state of California to about 800 staff, WIC staff members. So just to share with you what our training day looked like. We trained for a full day. It was, as Shannon mentioned, learner-centered, participant-centered education is the norm throughout California WIC. So our training was designed utilizing motivational interviewing techniques and in a learner-centered fashion. And it was a full day, but it was a full, fun-filled full day. And so we started with a warm-up activity to basically affirm the skills of the staff and the empathy they feel towards the clients, because WIC staff in general have great empathy and really care about our clients. We shared with them the history of the project and the results of the research, just like Shannon shared with us earlier. And this was very helpful, because the staff usually walks in with the apprehension that talking to clients about their alcohol consumption is not an easy task, and they're always nervous about it. They don't want to be judgmental, and they don't know how to come across and how to make it a positive experience for the client. We engaged them in dialogue about their experience talking to clients about alcohol, and that was always interesting to share, because sometimes they had positive and sometimes they had negative experiences that they were so happy to share. We shared with them the screening form that Shannon talked about, which is very, very easy to use, and they really loved looking at such a screening form that incorporates alcohol consumption with the nutrition questions. And then we showed them, we modeled an intervention encounter. We actually showed them 2 vignettes as part of a DVD presentation. One was with a WIC client who is a little challenging, and then the second one was with a WIC client who was quite challenging, and they could really identify with those vignettes, because it brought it to light that we understand where they're coming from and what they go through on a regular basis. After that, we reviewed the brief intervention manual, which Shannon talked about, and we went through it page by page so they feel comfortable, they know what it's all about, and it goes through what Shannon, just like Shannon mentioned, it goes through the consequences of drinking, that there's no safe level of alcohol when somebody's pregnant and to the baby. We talked about when are they more likely to drink, and how can they cope with that. And a fun activity that we incorporated in the training was identifying what is a standard drink. And that was really fun for them to learn that really a margarita is not just one drink. And some of them drink more than one margarita. And then we talked about troubleshooting, and we also shared with them some transitional statements, because that was always a tricky part of, once you've identified the client as drinking, how do you transition to use the brief intervention workbook? So they really appreciated that. And then a large portion of the day was practicing the brief intervention. This was the immediacy part of the training, and applying what they learned quite right at the training, so that they feel comfortable the next day when they go and implement using the brief intervention. And of course, there was closing and evaluation at the end. And speaking of evaluation, we asked the staff, what are one or two things you are taking away from today that you will try using with your participants? And I wanted to share a few quotes with you from the trainings. One staff said, the workbook provides guidance through the goal-setting process. Another one said, how to handle a difficult client will always be challenging. Thanks for the examples of what to say. Another one said, I feel more comfortable with the approach to talk to women thanks to the wonderful tool you gave us, WIC Project Care. And last but not least, this is a positive approach when working with participants, very non-judgmental. And we heard that theme over and over again from the staff about the fact that this was quite non-judgmental. And as with any funded project, there's evaluation, and that is forthcoming. Northrop Grumman's FASD Center for Excellence is currently evaluating outcomes for the expansion to 6 states, and then implementation is underway at the California WIC agencies that were trained. So in the few years that we've been doing this, whether it was part of the research and part of the implementation, we learned a few things, and it's a review of what we've talked about so far today, and that is improved screening techniques does increase the detection of alcohol use, and that brief intervention does appear to result in a greater reduction in drinking scores following one intervention, and it's usually maintained throughout pregnancy. The brief intervention does impact WIC infant outcomes, just like Shannon shared, and the WIC staff reported feeling prepared to help their pregnant clients address their drinking. It was really interesting noticing how staff would walk in with a certain attitude that, oh, we're here for yet another alcohol-related training, and they walked out with big smiles on their face saying, this is so helpful. Now we feel way more prepared about talking to a client about her alcohol consumption. And I do want to mention that the brief intervention really is geared towards a social drinker. It is not geared towards a WIC client who basically uses alcohol as a major part of her caloric intake every day. And so this really helped the staff realize that there is a difference. In a social drinker, we can address the situation using a very simple, easy, low-cost, well-tested brief intervention material. And that can serve as a model for the state and nationwide prevention of fetal alcohol spectrum disorder in a community-based setting. Shannon talked about the article that was published in the HAPH, and you can download it from their website, but also you have the policy brief that was written by Lori and her team at the California WIC Association. It's 4 pages long, and this is a great tool to use when talking to legislators. I know I have used it personally when visiting with legislators, and some of us are going to Washington, D.C. this weekend, and we will be sharing that, and I invite you and encourage you to download this from the California WIC Association website because it basically encompasses everything that we've talked about, and it also includes some recommendations. It includes more than this, but we wanted to highlight a couple that were shared in the policy brief. And basically, as state and local WIC directors, sorry, I've lost my notes here. But basically, as the state and local WIC directors, we can look to standardize the prenatal questionnaires to include evidence-based screening tools for alcohol use, and using the brief intervention tools that we shared with you. And both of those, we are happy to share with you the screening tool, and then the brief intervention workbook is available on our website, and we will be sharing the website with you at the end. And also, really, we need to encourage Congress to fully fund screening and referrals for alcohol and drug use as a core WIC nutrition service and administration function rather than an unfunded mandate, so to speak, to talk about alcohol. And the good news is that FNS has funded the updating and replacing the substance abuse materials. And the goal is to develop resource materials for use by WIC professionals and participants that reflect the current evidence-based practices and epidemiological trends. And we are part of their advisory team with JMH Education and Marketing in partnership with Jumpstart. And they have great ideas about resource material, including online resources that have great potential to help the WIC community reduce substance abuse in our population. And we encourage you and invite you to contact us. You have our contact information right here. There's Shannon's, mine, and then our public phfewic.org website. Thank you very much.
Thanks, Shannon and Samar, for a wonderful presentation. It's just really exciting to hear that you guys have taken a very simple, brief intervention and documented what the amazing results are, truly saving lives. So we're glad to hear that the word is spreading across the country, and like you said, we'll be going to Washington, and we'll be telling folks on the Hill what an amazing impact we have with our Nutrition Services and Administration funding, so they don't cut it, right? So right now we have a few minutes. We're running a little bit late, but we'd be happy to take any questions. I think that the great thing about this webinar is that there's a lot of resources already on the web, and Shannon and Samar covered where you can find those. The policy brief also has the links to the PHFE WIC website, which has the brief intervention tools all set to go, and I'm sure the training is available. So we urge people to consider picking this up. It's a fabulous intervention that actually saves lives. Like we said, we will be posting this entire presentation on our website in a few days with all the resources and links that you need. So everything you need to share this with your staff and spread the word will be available to you on our website.
Right now you should see on our screen one of the pages on our website that has our publications, and in the lower right corner there you'll see the policy brief, WIC Works Reducing Alcohol Use During Pregnancy Saves Lives. So you just click on that and loads up the PDF, and you can print it out and share with folks or forward it electronically. So we hope you use that as a resource. Any questions out there? We're not seeing any coming in, but we'd be happy to take any that you have.
Well, with that, I think it was a pretty straightforward presentation. I'd like to thank Samar and Shannon once again for your wonderful work, and to all of you for listening. Margaret for putting the webinar on. This is the last in our winter series of webinars. We'll be taking a month or so break, and then we'll be putting on a new series of quick and easy, fun webinars to share with you how WIC is working in the community to improve public health. Thanks, everyone, and see you soon. 122.